welcome back to Cityline. I have a brand new person on the comfy couch. We got to mark this day, April 24th, when we got to meet the Interim Executive Director of the Tacoma-Pierce County Health Department, otherwise known as Cindian Gizzi. Hello, my dear.
Hello.
Gosh, your name just rolls right off the tongue. Cindian Gizzi.
Yes.
And I asked you, what does Cindian mean, and what did you tell me?
Yeah, it's made up. I'm named after my father, Dan, because I was born on his birthday, and so I guess my mom was feeling creative after birth, right?
But what is your middle name?
My middle name is Suzanne, which is named after my mother.
Okay, so fair
yes,
time for both
the only
parents.
child of my father and mother. That's, yeah.
I love that.
Yeah.
So, well, welcome. Now, you are
Thank
serving as the Interim Director for the Health Department of Tacoma-Pierce County. So, I first want to say, what a gift for us here at TV Tacoma and Cityline to get an interim executive director on the couch, because usually you are running so fast and furious, and you being anybody who takes that title on, that you don't have time to explain what you're doing. You're just trying to keep everything going.
That is true. That is
All the balls
completely
in the
true.
air.
That's right.
So let's talk about how is the recruitment for our permanent director of health going, since we said goodbye to Dr. Chin.
We did. We said goodbye to Dr. Anthony Chen at the end of June. What's nice is we are still contracting with him to be our health officer for the county, and that's a really important role. And so Dr. Chen is a physician. I'm not a physician. So we need a physician to be our health officer and really to be there when you know, we get unusual diseases, which we have had.
Which we're going to talk about that, yes.
And so he's still with us, just kind of in the background.
That's good to know.
Yeah, so the Board of Health tapped me as interim director. I'm usually the deputy director. That's my role there typically.
Okay.
And so they are engaging in a national recruitment process for the Director of Health, and we're right in the middle of it. More to come. Yeah, but we've had staff have been able to interview some final candidates. We've involved community partners, quite a bit of community partners in this recruitment process, because they're so important with this position. And so they've had a chance to interview some candidates, and so we're waiting to hear about next steps now.
You know, the Department of Health and this position, boy, if we could thank COVID for anything, it would be just the awareness of how crucial the Department of Health. If we had any doubts, doubt no longer. So tell us about the leadership at the organization. What's the makeup of the team? Because now that we know we're going to see Dr. Chin, who else do you have running around that wonderful organization?
Yeah, we're really fortunate to have a strong leadership team at the health department, and they are all filling in during this time.
Yay!
We have division directors, communicable disease, strengthening families, environmental health, which demonstrates the breadth of what we do at the health department. And what's really important to us at the leadership team is that we have diverse members of that management team, we call it. And so, you know, we really try to make sure that in all of our staff and our leadership teams, we reflect the communities that we serve. And so we have a variety of women leaders and different race, gender, sexual orientation among our management team, which is really cool and so important in the work that we do.
And you have, it's so important, you have a new director of Justice, Equity, and Diversity Initiatives. Tell us who this is.
Yeah, so we recently hired Charlie Parker as our Director of Justice, Equity, and Diversity Initiatives. He is already just doing fabulous work, really helping us think about and reflect on how we can be an anti-racist organization, multicultural organization. Again, we know that racism is a public health crisis. And so it was important to us to add a leadership position to work on that, help us work through it.
We love our mayor, Mayor Woodard's referendum 60422. We are a compassionate city.
Yes.
Let's talk about it's back to school. Like I said in the opening, I mean, my legs were like, should I put tights on today? Should I wear the boots? Should I not? So let's talk about what do we need to know in terms of, I mean, let's just hit the whole gambit.
Okay.
Flu, vaccination, RSV,
Yes.
COVID.
Yes.
Just give us the full meal deal, Cindian.
Yes. Well, respiratory illness season is right around the corner, as you said. And excuse me, so COVID, as you know, obviously on everyone's minds, and we are seeing an uptick.
Yep.
And as we are in the nation, we're also seeing that in Pierce County. And so our message, as it has been, is to make sure that you're fully vaccinated.
Yes.
We have a new vaccine booster coming up in about a month. And so that's something where they have matched and tried to identify what are the major strains and match the vaccine to that, similar to how they do the flu shot. So,
Absolutely.
So our message is very similar for flu shots, COVID shots, and that is your best protection is to get those vaccines.
Absolutely.
Yes.
And remember, everything that COVID has taught us is
Yes.
it's not new information.
Right. Same thing that we said for COVID applies for flu, for RSV, any of those respiratory illnesses. And so that is if you're immunocompromised, you have chronic diseases that make you more vulnerable, you might want to take steps like putting a mask on. Everyone should stay home when they are sick. Sanitize those hands, wash those
That's right.
hands.
I swear,
Yes.
every time I buy a new red lipstick, the COVID numbers go up, and I have to wear a mask again. So let's talk about, in addition to COVID, we have new illnesses we never thought we'd be talking about, tick-borne illnesses and a fungal infection. That sounds like something parents need to know.
Yes, we have had some unusual illnesses come into Pierce County. So the tick-borne disease that you referenced, that's anaplasmosis. And so we have a woman in Puyallup who contracted this illness from a tick. And the message there, it was actually the first case, actually it was the second case, sorry, in Washington State. So we know it's here now in Pierce County. So anyone who walks, this person had been hiking and walking in East Pierce County in a wooded area. And so that's the message, is when you do go walking, hiking in wooded areas, when you come home, make sure you check your body, check your pets for ticks and get them off you right away. When you are hiking, wear long pants, long sleeves if you can, to prevent the ticks from attaching in the first place. So that's anaplasmosis. The fungal infection that you mentioned, that's Candida auris. And that, again, was an unusual, well, the CDC, which is Centers for Disease Control and Prevention, while they have identified cases, thousands of cases nationwide, this was the first case in Washington State where we know the person contracted it in Washington State. And so this, again, is a fungal infection. Sometimes it can be, you've heard, maybe multi-resistant for the antibiotics that treat it. And so this is something, again, that we're working with our healthcare providers to make sure that they know it's here in Pierce County.
That's right.
They check their patients for it and are on the lookout for it.
So this next topic, we're going to let our parents know they might want to take the little ones out of the room because there's some words that they may not know, that they're too young to know yet.
Sure.
So take a second. Okay. There's something else showing up that we have to be aware
There
of.
is.
And we're going to show a quick PSA, but we're going to talk over it. Tell us what it is.
Yes, syphilis is on the rise. Syphilis is a sexually transmitted infection. And so our message is, if you are 45 and over and have sex, you need to get tested for syphilis. And so in some of our campaign messages, we like to use a little bit of humor, appropriate humor, to let people know. Sometimes it makes it easier for people to hear the message. But again, 45 and younger and have sex, get tested for syphilis. We're seeing it, unfortunately, increase in some of the babies born with syphilis. And, you know, it's a really serious disease and illness. So we really want people to get tested. We want syphilis to become extinct. That's another campaign that we have using dinosaurs and Jurassic Park-like themes.
Well, if we can use chocolate, we can use dinosaurs.
We can use dinosaurs, yes.
Absolutely. And,
yes.
and let's talk about some of the community members in this last few minutes that you've reached out to.
Yeah.
I would imagine Pierce County AIDS Foundation. Who else?
Absolutely, and especially with our MPOX work, which again, our communications team, if I can give a shout out to them, right? They've done some tremendous work around that. But yes, Pierce County AIDS Foundation, Rainbow Center, and that's again part of our effort of reaching people who are most at risk, most vulnerable for these diseases, part of our health equity and racial equity and justice work. So yes, tremendous campaign and partnerships that are so important to public health.
Well, yes, and I got to tell you, I think the health department historically and as we sit here has some of the best sense of humor. I mean, those are those things that you remember growing up or a certain ad campaign. And so the people that you hire to do your marketing, award-winning people.
They are. They have won awards by the Public Relations Society of America and Puget Sound. So we're so proud of them. Yes.
I love that. Okay, so last minute and a half here. What do we want to leave folks with? Just some real simple steps coming up here for back to school.
Sure. Back to school, again, we think of immunizations, childhood immunizations. And so just want to remind folks that they can go to our website at tpchd.org/kidsvax. And we've got information around upcoming vaccine clinics. It's back to school, and it's really important for our kids to be up to date on their vaccinations.
Absolutely.
Yeah.
And one of my questions was, now that I think about getting vaccinated and it's time for me to get my booster, when this all opened up to begin with back in March of 2020, we saw grocery stores having vaccinations and boosters and things. Will that still be that kind of demographic in the fall for us to get revaccinated or reboosted?
Yes, there should be a booster coming out, in about the next month again, that's very well matched with some of the strains that we're seeing. So people can go to pharmacies, they can go to their health provider, they can go to our website to find out where they can get their COVID booster and vaccine. Yeah.
Miss Cindian, Suzanne.
Gotta
Your mom
honor
is
the
going to
mom.
kill me when she sees this. Sorry, Mom. You are a delight. And I want to have you back on this couch as it starts to get cold. And we need some reminders of how to keep ourselves healthy.
There's so much more that the health department does. We would love to come back and share more.
It's a date.
Okay.
We have much more to come on Cityline. Don't go away. We'll be right back.